Welcome to the Healthcare Experience Academy course on creating HCAHPS excellence. This lesson focuses on supporting you to build domain-specific action items relative to nurse communication and will be heavily influenced and guided by the support resources in your HCAHPS Experience Guide for the nursing communication domain and the specific items that make up the questions that patients respond to around nurse communication. So let's take a look. The 3 questions that make up the nursing communication domain are: during this hospital stay, how often did nurses treat you with courtesy and respect, listen carefully to you, and explain things in a way you could understand? And the response options are always, usually, sometimes, and never. And as you can see here in this pie chart, 80% of the time, patients say that nurses always did these things. And one thing that we will say is, because of HCAHPS attribution, sometimes it's really hard for a patient to discern who is and isn't a nurse. So we recommend that these are standards for all employees. 16% of the time, patients say usually, and just a fraction of time, patients say sometimes or never. So our opportunity for improvement is going from usually to always. And what we know in our research from PRC is that within the nursing domain, listen carefully carries the most weight in terms of influencing patient perceptions, which then has a positive effect on courtesy and respect and explain things in a way that patients understand. So some simple tips, and there's much more depth in your experience guide.